There are so many different type of medications in modern medicine, which includes antibiotics, painkillers, and medicines which to control heart-related diseases or kidney-related diseases or brain stroke, and the list goes on. And one among the medicine is steroid. Actually, steroid is prescribed only in very few conditions. It's a very powerful medication. In this video, I'll be talking to you only ENT related problems where you need steroids. Approximately in 15 conditions in ENT, we need to prescribe steroid, and specifically in 3-4 conditions in ENT, and steroid is the only medication, and that too it has to be taken at the earliest, say at least within 2 weeks of the starting of the disease. So, as I've already mentioned, steroid is a very powerful medication and it is very effective, and along with that you have so many side effects also. And when we tell the patient about the side effects, some of the patients, they skip the medicine, they don't take it. So in this video, let me tell you the side effect of steroids and how to lower the side effect, how to manage the side effect. To start with, blood pressure will shoot up, blood sugar will shoot up, especially so if they are already known case of hypertension and diabetes. The second class of patients where their blood sugar and blood pressure is normal, but the patient's parents happen to be hypertensive and diabetic and their blood sugar is very high. In these type of patients, when you start steroids, there is high possibility that the blood sugar and blood pressure may shoot up. And the third category where they are non-hypertensive and they are not diabetic and they are young, in that case the level will be slightly high and it will not affect them much. Coming to the next side effect, where the pressure of the eye inside the eye increases. It's called as glaucoma. The next being the acidity level in the stomach increases. Then those patients who are above the age of 40 or 50 or already they have a bone problem, and if these patients are taking steroids for months together, there's a possibility the bone may become weak and they may develop fracture. Usually in ENT, we prescribe steroids usually for 5 days or maximum of 20 days. That too we used to taper it. We used to decrease the dose every 5th day and we can stop the medication by 20 days. So this side effect of bone fracture is not much. Usually is for those patients who take it for a long time. Now you have other side effects like hair fall, acne formation, slight mood variation, sleep disturbances, stray in the stomach, in the skin, in the skin, and menstrual irregularities. All these are other small side effects. So now I'll tell you how to decrease the side effects. So as soon as your ENT doctor has prescribed steroids, please do take it in the proper way, proper dose and the proper time, like how it has been prescribed to you. So as soon as it is prescribed, you please visit your family physician every 3rd day and get your blood sugar and blood pressure checked. Blood pressure and blood sugar to be checked. Suppose it is on the rise, the physician will increase the dose for that so that it is brought under control. So every 3rd day you have to meet till the first 20 days, till the total 20 days. Once the dose of steroid is over, the physician will decrease the dose of your medicine and you can come back to normal. Suppose you have already been diagnosed as glaucoma, which means high pressure inside your eyeball. In that case, before starting the steroids, I'll advise go meet your ophthalmologist. They will check your eye pressure and they'll decide whether this dose of steroid is suitable for you or not. If the doctor ophthalmologist feels that it is of high dose, maybe they will give a call to your ENT specialist. They will have a discussion. They'll decide on the dosage to be given, and that particular dose you can continue. But keep in mind, you have to check your eye pressure frequently as advised by your ophthalmologist, and there will be a small variation in your eye drops and the medication. Maybe the medication dose will be increased. Whenever you take the steroids, take it after food. Means if the doctor is advised in the morning, take it after breakfast. If it is twice daily, it should be after breakfast and after dinner. And that food should be of normal quantity. Try to avoid spicy food, hot and spicy food. And try to avoid oily foods too. More of vegetables is better for you. More of salads, still good. And just before you, half an hour before your food, try to take anti-reflux medications like rabiprazole, omeprazole, lansoprazole, esomeprazole, any one among them. So it has to be twice daily. So most probably your ENT doctor must have prescribed at least once daily steroid, and that will be in the morning, or maximum of twice daily. So you have to take this anti-acid reflux medication half an hour before food. Regarding the other complications like hair fall, weight gain, edema in the foot, pedal edema, skin striations, then mood variability, irritability, sleeplessness, moon phase appearance, all this will come down without any specific medication. Just wait 10 to 15 days or maximum of 2 to 3 weeks after stopping the steroids, it will come back to normal. To summarize, if the ENT doctor has advised you to take steroids, please do take it. But keep in mind, these are the side effects, and consult your family physician, and if necessary, if you have already been diagnosed with glaucoma, you have to meet your ophthalmologist also. Because if you delay steroids or if you don't take it in the proper way, it will produce permanent damage to that particular ENT organ. So follow the instructions properly so that we can minimize the side effect. Thank you so much.